Well, I don't want to interrupt that dialogue. um, I certainly look at the budgetary issues that came out of one big beautiful bill, or we call it the big ugly bill on our side. Um, it really has created massive budget holes in Medicaid and SNAP, forcing states like Colorado to make really difficult, almost impossible decisions in balancing their budget. The shutdown has only made it worse. And I think as states are forced to make up for Trump's cuts in key programs, states across the country are wrestling with the same issue that Colorado is. These are impossible decisions impacting real families as they try to balance their budgets after the drop-off, the dramatic drop-off at various levels from the federal government. So in Colorado, the states had to make a sequence of very difficult cuts around Medicaid dental care, affordable housing programs, higher education funding, public health services. They're almost impossible to make because of all at every level, these cuts in federal funding to states. So, President Turner, as you know, there is a crisis going on right now, a healthcare crisis unfolding across the country. In the next several days, millions of Americans will receive notices in the mail that their premiums aren't just going up 15 or 20%, but going up, in many cases, 50%, 100%, as in advance of the open enrollment that starts on November 1st. This is on top of the millions of Americans that will lose their access to Medicaid because of the cuts that came across from the big beautiful bill. President Turner, in your testimony, you talk about the impacts of loss of access to care. What this is not just the impact on the patients, but also on the providers who care for them. Obviously, especially the nurses. Layoffs, unsafe staffing, service reductions. These are all exaggerated at rural hospitals. When you look at these cuts, what is the single thing that keeps you up at night? What's the part that you look at as what happens to nurses in rural areas if they're no longer able to care for patients?
Especially thank you, Senator, for that question, especially in rural America, all of these communities, oftentimes, whatever healthcare facility they have, be it a nursing home, a hospital, or a clinic, they're probably like the biggest employer of the town, okay? At least that's how it is in Minnesota. And so you start having all these hospitals close, or clinics, or whatever it might be, close because they can't afford to stay open, that has a ripple effect, an economic ripple effect, and it turns that town into a ghost town. Because I'm sorry, you take away the healthcare facility and the school, and a town dies. And we've all seen it. You got one grocery store and maybe one bar, and that's all that's left. Okay? So it's denying. And then let's just take the labor and delivery world. I dread to have been having children nowadays if I'm in rural America and you're having to travel 50, 100 miles when you're in labor because the nearest place is the big town.
I hear you. Your point is well made.
Thank you.
Mr. Arnold, I'm a firm believer in diverse, cost-effective pathways to careers. We've millions of young people each year that are choosing not to go to a four-year college. That just growing. We need strong pathways for them. While I was governor, we started working on expanding quality youth apprenticeship programs. A lot of what we started in Colorado, I think we're in 22 states. In your testimony, you mentioned it takes a long time to become a trusted journeyman, capable of the complex work you do. You also honed your skills as a mechanic in the Army. Another example of earn while you learn model. From your perspective on the shop floor, could you speak to the value of apprenticeship programs for building the kind of highly skilled, robust workforce that our aerospace, defense industries, and so many others all depend on?
Thank you for your question, Senator. No amount of book learning can replace firsthand experience. I also have a four-year degree, but I also have done like you say, the Earn While You Learn program as well. And you might learn something from the engineers about how this is supposed to go together, but then if you go talk to the aircraft mechanic who puts it together, he will tell you that the blueprints are correct and it needs to be to the blueprint. However, you got to do it a certain way. And that type of tribal knowledge you only get from firsthand experience doing the job yourself. Things work great on a computer in a 3D rendering, but when you actually have to crawl in there and get that wiring harness in that compartment, there's a certain way of going about it, and you only learn that from actually doing it. And we have members that go through our training program, and they are taught by the members on the line who are doing the job, who've been doing the job for years.
Great, thank you very much. I yield back to the chair, whose gavel I want to point out is poised.
It's still up, though.